Hello, my name is Pirouz Motamedina, and along with Dr. Angie Arlen, we represent the educational leadership of our department. I'd like to take the next few minutes to give you a brief overview of our program. First off, a little housekeeping. Yale Urology strictly follows the conduct guidelines set forth by the Society of Academic Urology. We will not discuss your rank position during the match process. As you all know, urology is an early match, so we cannot participate in the formal couples match offered by the NRMP. If you are applying with a significant other, you are free to disclose this if you wish, and we will happily reach out to the other program on your behalf. We will not make any offers outside of the match. You are free to send thank you emails and notes, however, please do not expect a response in return. This is not a reflection of your candidacy, but rather our department policy, and we in no way take these communications in consideration when drafting our rank list. You may write to ask specific questions about the program, and we will try to answer these to our best ability. Yale Urology does not accommodate second looks. However, you are free to visit the area if you wish. Our goals for training residents are threefold. First, surgical proficiency to pursue any career path the resident may choose. Next, a strong foundation in urologic knowledge to ensure they will provide high-quality care. And lastly, academic curiosity with the tools to conduct high-quality research to advance the field of urology. We are currently a 5-year program with 3 residents each year. Additionally, we have 2 clinical fellowships, one in endourology and another one shared with gynecology in female pelvic medicine and reconstructive surgery. Additionally, we have 2 academic or research fellows in quality improvement and oncology. We have worked hard over the years to refine our program to build an environment that promotes clinical learning, academics, and overall personal well-being. Here are a few highlights to bring to your attention. Yale New Haven Hospital provides a competitive salary to allow a comfortable lifestyle in the Northeast. The residents are also provided full benefits, money for meals when on call, and an annual academic stipend, which has been used for exams, computers, personal lead, you name it. We, however, do purchase loops for each of our residents early on, so that's one less thing to worry about. One of the perks of academic medicine is the opportunity to share your research and learn from the thought leaders at various national conferences, and the department will fully support this. We take holistic wellness seriously, and I will discuss this later on in further detail. One example of physical wellness is our Fitbit Challenge in the spring. Inspired by March Madness, our residents are given Fitbits and compete in various bracket-style competitions. Not surprisingly, our consult residents get in a lot of steps. We've participated in global health initiatives in the past. Unfortunately, these were put on hold during the height of COVID, but we look forward to restarting them soon. And lastly, our resident rotations are adapting and improving as needs change and opportunities arise. One example is designated elective blocks for senior residents akin to a mini fellowship in fields of interest. Another is the night float system to reduce the amount of call residents take. And new this year is a research block we implemented to allow residents opportunities to perform high-quality studies. What's important is that these changes usually come as suggestions from residents and are developed in conjunction with them. Our residents participate in robust and balanced didactics. We use the AUA University as our backbone of the core curriculum. We have a weekly grand rounds, which is often an outside speaker, tumor board, and indication conferences. Other monthly events include Surgical Skills Lab, Journal Club, M&M Conference, subspecialty theme radiology conferences, and various faculty lectures. Here's a breakdown of the current blocks our residents rotate through. The Uro 1 class spends 6 months on urology and 6 months on general surgery, learning the basic perioperative management of surgical patients. During the second year, you will spend the majority of your time on the York Street campus, which is our main hospital, and some time on St. Raphael's campus, which is our large, busy community hospital. 2 months are spent on a dedicated FPMRS Urogyn rotation, and the remaining 2 months are used for research. This whole year is a formative year in establishing a strong foundation in urology. The Euro 3 year includes 2 months again of research and 2 months of dedicated pediatrics. This year sees a big jump in autonomy with 4 months at the VA with a heavy clinical, procedural, and surgical experience, and 4 non-consecutive months as the in-house night float resident. The Euro 4 is the chief in training, with 8 months at York Street overseeing the benign or oncology teams, 2 more months of pediatrics, and 2 months of elective. And finally, our chief residents spend an equal time across our 3 main sites with a great balance in advanced surgical cases and ambulatory clinics to ensure they are practice ready upon graduation. Recognition of the importance of wellness in medicine has become increasingly common. However, this was not always the case. Here at Yale, though, we implemented a wellness curriculum early on, knowing that building healthy habits now would increase the chances that they would be continued well into your careers. The wellness wheel pictured here guides the various events and activities we incorporate into our curriculum to achieve holistic wellness. These various events have allowed us to grow stronger both physically and emotionally, feel more connected with each other in the community, acquire interpersonal skills to function as compassionate leaders, and have some fun along the way.
Hi, this is Tom Martin. I'm the Executive Vice Chair and Vice Chair of Clinical Affairs for Yale Urology. I wanted to take this opportunity to give you a brief overview of who we are and where we practice. As you can see from this slide, we have a large faculty of both pediatric and adult urologists. We have an extensive clinic volume of patients seen each year, as well as a high surgical volume. We're fortunate enough to have all of the latest technology, including the Da Vinci surgical system, Da Vinci single port system, the Artemis and ExactView prostate biopsy system, and the Moses laser for holmium laser enucleation of the prostate and large volume stones. Our department has grown rapidly over the course of the past 10 years and currently practices at 16 locations across coastal Connecticut and the Rhode Island shoreline. In addition, we have a keen interest in the practice of quality urology as manifested by the presence of a quality fellowship, a quality committee, and funded quality improvement projects performed each year by our residents.
As you can see here, Yale Urology is present at a wide variety of locations across the state of Connecticut and extending on our western border to Westchester, New York, and on our eastern border to Westerly, Rhode Island. In addition, Yale Urology maintains a strong presence at the West Haven Veterans Administration Hospital, which is located approximately 5 minutes from Yale New Haven Hospital. Our residents work predominantly at the locations you'll see noted on this slide, at the combined campuses of Yale New Haven Hospital, at the West Haven Veterans Administration Hospital, and at Lawrence Memorial Hospital on our eastern shoreline.
To give you some background on Yale New Haven Hospital, it's currently the 3rd largest hospital in the United States with over 2,600 beds across 2 campuses. On the left side of your screen is depicted the York Street campus, which is comprised of Yale New Haven Hospital, the Smilow Cancer Hospital, and the Yale New Haven Children's Hospital. On the right side of your screen is the St. Raphael campus, which is located approximately 1 mile away and provides a bit more of a community hospital feel, but with many of the same technological and facilities advantages seen at York Street. The Smilow Cancer Hospital is an integral part of the Yale Urology residency program. It's a comprehensive cancer hospital with multidisciplinary care, including medical oncology, radiation oncology, and surgical treatment. Our residents participate in a weekly urologic tumor board where multidisciplinary cancer treatment plans are formulated. The West Haven VA Hospital is located approximately 5 minutes away in West Haven, Connecticut. It's a large referral center for veteran patients across New England and provides the full spectrum of care, including urologic care with a Da Vinci robot and Artemis fusion biopsy system. It provides residents a great opportunity to sharpen their skills with a good blend of autonomy and supervision. Most of the attending physicians at the VA are also Yale Urology faculty. To go with our various practice sites, we have a large number of dedicated faculty members subdivided into divisions based on their areas of interest and expertise. They come from diverse training and practice backgrounds before having been recruited to the Yale faculty, and accordingly provide our residents with a wide perspective of urologic care. Dr. Tom Buckley is the chief of the Division of Clinical Urology and Endourology. The section of Clinical Urology provides residents exposure to the bread and butter of outpatient urology, but also to the exposure of cutting-edge BPH surgical management and management of urinary stone disease. Most importantly, residents are exposed to the compassionate longitudinal care necessary for a successful practice from these faculty members. The section of endourology is headed by Dr. Dinesh Singh, and the members of this division focus primarily on complex kidney stone management and independently obtained access for percutaneous nephrolithotomy. Yale Urology also boasts a multidisciplinary stone center staffed by urologists, nephrologists, and nutritionists as part of this section. Dr. Adam Hittleman is our chief of the Division of Pediatric Urology. Faculty members in this division extend their expertise across multiple practice locations in Connecticut. Given our affiliation with the Children's Hospital, our residents are exposed to a wide range of urologic issues, starting in the antenatal period and extending into early adulthood. Dr. Harris Foster leads our Division of Lower Urinary Tract Dysfunction and Reconstruction. This division has multiple interests, including BPH, urethral stricture disease, neurourology, and female pelvic medicine and reconstruction. As you can see, we have our bases covered clinically across a wide array of urologic subspecialties in this division, and our residents benefit greatly from this diversity and expertise. The Division of Urologic Oncology and Andrology is led by Dr. Patrick Kenny, a member of its section of oncology. As a resident, your surgical experience with these faculty members will include a high volume of robotic and open surgery. You'll be very comfortable with MRI fusion biopsies and also exposed to other cutting-edge techniques, including prostate focal and whole gland therapies, amongst others. Our residents are active participants in multi-specialty tumor boards and help determine treatment plans for complex patients. Dr. Stan Honig is the Chief of Sexual Medicine and Reproductive Health, a section within this division. Residents working with faculty members in this section will become experienced in andrology, sexual dysfunction, infertility, and microsurgery. Dr. Jamie Cavallo is our Vice Chair of Urology Quality and Safety, and I've had the opportunity to work closely with Jamie in co-chairing the Urology Quality Assurance and Improvement Committee, or UQAC. This is a committee whose goal is to promote and maintain high-quality care throughout Yale Urology and across our hospital system. It's a joint effort between resident and faculty staff members, and residents are encouraged to submit ideas for new project development and also to participate closely with a variety of our partners across the health system in developing new initiatives. In the past, these initiatives have served to decrease our surgical site infections, to decrease our VTE rate in postoperative patients. They've shortened the time in which a patient with testicular torsion proceeds from the door of the emergency room to the operating room for surgical correction. They've also resulted in a variety of care signature pathways, which are multidisciplinary efforts to standardize care in a disease-specific way across our health system. And finally, they've led a video review of faculty and resident participation in minimally invasive procedures by expert surgeons. Each of these initiatives have been a success thanks to UQAC, the residents, and welcome collaborations across the health system.
Welcome to Yale Urology. My name is Michael Liebman. I'm a urologic oncologist and associate professor in the Department of Urology. I'm thrilled to give you a brief overview of the exciting and diverse research programs available at Yale. The Department of Urology exists within a remarkably exciting and innovative research ecosystem within the university. As an institution, Yale has been dedicated to expanding and sharing knowledge. It ranks 6th currently in the United States in federal funding with over $500 million of NIH funding each year. A remarkable feat given the relatively smaller size of the faculty and reflects the high concentration of academic researchers within the institution. As a department, Yale Urology has rapidly expanded over the past 10 years and has made substantial academic footprints in the fields of pediatric urology, endourology, female pelvic medicine, basic and translational science, health services, and policy research. And as evidenced by this plot depicting the number of publications from our department over time, highlights the trajectory of this growth. And I want to take a few moments to highlight some of our faculty, our residents, and the innovative funded and in-progress work in research. This is by no means an exhaustive list, but does give a glimpse at some of the areas of strength and active investigation. Dr. Isaac Kim, professor and chair of the Department of Urology, is a urologic oncologist and global leader in the field of prostate cancer research. Dr. Kim's clinical research is focused on mechanisms of treatment resistance and specifically immunosuppressive factors produced by prostate cancer. He also has a strong interest in inflammation in cancer and the role of surgery in patients with advanced or metastatic prostate cancer. An exciting study that's open and a large part of Dr. Kim's practice at Yale seeks to explore the role of surgery in patients presenting with metastatic prostate cancer. To this end, Dr. Kim has helped establish an international team to prospectively evaluate surgical intervention, cytoreductive prostatectomy, in patients with de novo metastatic prostate cancer. This study will accrue up to 870 patients with metastatic prostate cancer and test the hypothesis that cytoreduction will render systemic therapy more effective and enhance quality of life for patients with metastatic prostate cancer. Dr. Leslie Rickey is Associate Professor of Urology and Vice Chair of Faculty Affairs in the Department of Urology. Her research interest focuses on female pelvic floor disorders and lower urinary tract dysfunction. She is the PI on a U01 program project grant funded by the NIDDK studying longitudinal predictors of the development of LUTS in women. The goal of the Prevention of Lower Urinary Tract Symptoms, or PLUS Consortium, is to conduct collaborative transdisciplinary studies to establish the evidence base for future intervention studies to promote bladder health and prevent LUTS in adolescent and adult women. The approach involves building a national population-based cohort and to assess individual, social, and environmental factors associated with pelvic floor dysfunction, ultimately assessing ecological factors that promote bladder health and contribute to LUTS initiation and progression. In the field of prostate cancer imaging, Dr. Preston Sprinkle is a urologic oncologist and associate professor of urology, chief of urology at VA Connecticut, whose research interests focus on the optimization of image-guided biopsy and focal therapy for prostate cancer. Dr. Sprinkle leads a multidisciplinary team of radiologists, urologists, pathologists, and experts in machine learning to integrate imaging, genomics, and develop predictive models to improve diagnostic estimates of clinical outcome. In addition, Dr. Sprinkle's prospective cohort of MRI ultrasound fusion biopsies is one of the largest and best clinically annotated, and has been the source of numerous publications from our residents. I am a urologic oncologist with an interest in health services and clinical outcomes research. My clinical and research interests are centered on improving outcomes for patients with urologic cancers. And in particular, these have converged in two broad areas. One, understanding and improving the adoption and integration of diagnostic technologies. And two, understanding accessibility and equity of healthcare delivery. Working with a wonderful group of collaborators at Yale, we have led studies using data derived from publicly available data sets, as well as novel sources, including institutional EMR data, administrative claims, and academic partnerships. To highlight the range of projects in this arena completed by residents and trainees, we've recently published our work looking at the alignment of FDA approvals for checkpoint inhibitors and clinical implementation of treatments for patients with advanced cancer. We have also led real-world evidence studies examining the effectiveness of MRI and genomic testing, and innovative health policy studies co-led by health economists at Yale from Yale's Center for Cancer Outcomes, Public Policy, and Effectiveness Research, examining the effects of the implementation of the Affordable Care Act. Much of this work has been resident-led and highly impactful. To highlight a few of the representative examples, Dr. Syed Rahman has published recently on oncologic outcomes of neoadjuvant chemotherapy in micropapillary variant bladder cancer. Som Lokeshwar led a study examining the clinical utility of MRI ultrasound fusion biopsy in patients with low suspicion lesions during active surveillance for prostate cancer. In addition, Ben Prest published a study looking at the prognostic association between the deciphered genomic classifier and outcomes during active surveillance. And Stephanie Hanchuk led an innovative scoping review exploring the evolving focus on physician and surgeon pregnancy. There is also a rich environment focused on translational and basic science in Yale Urology. Dr. Daryl Martin is an assistant professor in the department whose interests encompass both translational and biomedical research with a focus on understanding disease progression and improving patient risk stratification. Just to highlight a bit of the interesting work that Daryl and his team are up to, include developing a humanized mouse model of bladder cancer that's being used to study tumor biology and the impact of drugs on tumor microenvironment. Daryl and his team are also interested in identifying molecular signatures to improve patient selection by predicting which prostate tumors may be radiation sensitive or resistant. Dr. Fed Ghali, an assistant professor in the department, who is a urologic oncologist focused in bladder cancer, has a strong research interest in biomarker development in bladder cancer, including studies of urinary DNA biomarkers to identify predictors of response to therapy, leveraging a range of methods including machine learning and radiomics. In addition, Dr. Ghali has led and is leading a range of studies across a breadth of interests, including clinical trials in bladder cancer and strategies to reduce barriers to enrollment. Dr. Jian Kim is studying metabolomic dependencies and vulnerabilities, specifically occurring in highly aggressive subtypes of cancers. To this end, Dr. Kim and her team are using metabolomics and flux analyses by using both human specimens and animal and cell lines to measure metabolomic activities and alterations. The department supports a rich biospecimen repository, which consists of human cancer tissue from kidney, bladder, penile, prostate, testis, and upper tract disease, supporting clinical and translational research. We've also been broadly committed to leveraging our skill set to community and public health research for urologic care at Yale, a program which I think truly distinguishes our department. We understand that in addition to being at the cutting edge of research in the laboratory, we maintain a commitment to improving the overall health for all patients in our community. As we hope you will see, Yale Urology's footprint reaches far outside New Haven and into the entire state of Connecticut, as well as surrounding states with faculty in institutions in Rhode Island. In 2015, Yale Urology initiated a unique partnership with the Cornell Scott Hill Center, a federally qualified health center which is a local nonprofit community-based organization providing comprehensive primary health care regardless of insurance status or ability to pay. And in addition to overseeing this collaboration, we have also sought to study and share this model and examine its effect on residency training. In this notable project, led by one of our recent graduates and now faculty member at UCSD, we used two methods to examine the partnership, including a health network data-driven assessment of case volume and outcome, as well as survey interviews of residents to assess the impact on training and outcomes. Using objective measures, we found that Yale's resident-led partnership with the Community Health Center led to a robust clinical experience, extending care to over 1,000 members of the New Haven community. When speaking with our residents, we found this experience was extremely rewarding in terms of improving interpersonal and communication skills, as well as tangible skills such as autonomy in professional practice. More broadly, this research also highlights the need to place greater emphasis on measures of area-level health and reflects Yale's commitment to the region and the potential to study and disseminate effective methods of healthcare delivery, including projects led by many residents. Lastly, Yale Urology is extremely supportive of resident research, including support for attendance and participation in regional and national meetings. There are ample opportunities for mentorship both within our department or, if your interest guided, outside the department in the warm and welcoming research community at Yale. Thank you so much, and I look forward to meeting you all.
Hi, my name is Stephanie Hanchuk. I'm a current PGY3 at Yale Urology and happy to welcome you to our program today. I'll be giving you a sense of what it's like living in New Haven and being a part of our wonderful residency. As you can see here, New Haven is a remarkably diverse city with a great culture and ability to both walk and drive to work. We are nicely nestled on the East Coast between New York and Boston and take part in the lively Yale community. There are numerous opportunities on your days off to visit libraries, go to shows, concerts, the beach, hiking, and even take a stroll downtown and grab a coffee. As a former New Yorker, moving to New Haven had me a little nervous about what exactly was I going to do in all of my spare time outside of residency. It turns out there's not enough time to experience all that New Haven has to offer. As previously mentioned, we are nicely located in the middle of the Northeast corridor on both Amtrak and have local airports all surrounding us. On weekends off, you can find many of our residents at the public parks and beaches in the area. A favorite of mine is Sleeping Giant Park, where you can find simple hikes or you can go scrambling on rocks. There are also many lovely beaches along the Long Island Sound, where you can spend a nice day in the sun catching up with old friends. Beyond just going outside of New Haven, there's plenty of things to do in the downtown area. From shopping down the streets of Broadway to meeting up with co-residents and friends at Yale's graduate pub, Griffin's, and of course, trying our world-famous pizza in Wooster Square. New Haven has an extremely affordable cost of living in comparison to other large New England cities. As listed below, there are many options for housing, including luxury downtown apartments, townhomes in the surrounding area, and as well as homes in the surrounding suburbs. The majority of residents live in the downtown area with the ability to both drive or walk to work, with a few with families and pets who live in the surrounding suburbs. I can confidently say that not a single resident here commutes more than 15 minutes to work on a given day, which when you're working as much as we do, it's awesome to be able to save time on your commute both ways. I've really appreciated my time here in New Haven and look forward to the next 2 years to continue exploring the area. I hope you have been able to get a taste of what it's like, even though you weren't able to join us here today. Thank you.